Good morning, everyone. Just doing a quick sound check. Can anybody hear me?
I can hear you,
I can.
Kayla.
Wonderful.
Yeah.
There you go.
Yeah.
Woo!
Woohoo.
All right,
Nice.
we are in business, and it is 9 a.m. So I'm going to hand the microphone over to our MC for the hour, Mr. Vermeer.
Thank you, Kayla. That is very official. And I always like to give everybody a minute or two, because if they ran from a meeting at 8 o'clock or 8:30 or start at 9, it always takes a minute or two to get going. So I will be patient and give everybody a minute or two, and then we'll start with the MOTS CE webinar. Thank you all for coming. Looks like we have a nice turnout. And the good news of the day is it's not raining. Or I should say here it's not raining in Salem, maybe somewhere else. I shouldn't speak for, for myself, because especially with these webinars that are all over the place, people can be all over the United States these days. I have to kind of keep that in the back of my mind. It's still a lot of people, and that's, I'm assuming it's still, the majority is still Oregon, but then also all over Oregon. Thanks, Nicole. Pluviophiles, that's a new word. Is that the word of the day? I like that, actually. Word of the day, pluviophiles. And I agree, I enjoy a good bout of rain. But it can be a bit much sometimes. And when things start to overflow and people are starting being bothered by it, then, or specifically, personally, my golf course gets too wet, so you can't play on it anymore. So that's, you have to find that nice balance. So. Okay, 9:02. Thank you all for joining. It looks like the number is kind of set on a certain amount, so we're here. Welcome to our MOTS CE webinar, February 7th, 2024. We are here with the whole gang. The event will be recorded, as it always nicely states, and I saw it pop on. So this will be recorded for those of you who are pulled out of a meeting, or there's some fire to put out, an emergency, phone rings, and you can't watch the whole thing. Then just you can always watch it later, because and it goes pretty quick these days. We have it on our website within a day or two, and then you can pick it up where you left off, or the bit you missed, or something like that. Or maybe you want to share it with some of your coworkers, because there's information coming on that I think will pertain to a lot of us within the behavioral health world, and everybody working with MOTS and the new system that's in the making that will replace eventually MOTS, the road system. So, okay, Kayla, go ahead with the agenda. There we are. It's pretty nice and full. We're going to, a little welcome that you got, and I'm going to introduce the MOTS team for those of you who are not familiar, and it's MOTS/roads teams, because we're kind of in transition. So why do we do this? Then Justin is going to talk about adding test clients. Kelly, who is new to the team, for most of you, I think, or some of you who might not have run into her. So she will be talking about the newsletter upgrade that we have, the MFA, the multi-factor authentication in roads. That's a wonderful new thing. And that is because of security, and Kayla will tell you all about it. Then we need MFA, multi-factor authentication beta testers. And a big thank you from Kayla. Another webinar coming up. Mary will talk about that. A little intro to MOTS that we do on a regular basis. And of course, Jody is always here. We're switching from CE to EDI, or from one EDI to another EDI. There's more room for Q&A, and during the presentations, or any presentations, you can always put it in the chat if you have a question, or raise your hand or something, and we can kind of give you the mic if you want to speak up or have anything. And we end with all the contact information that we have available. So, and we will give that to you. So, okay, go ahead with the next slide, Kayla. There we are, and see, Kelly is there. And she stands out a little bit. Kayla, our MOTS system administrator and roads product owner. She will probably transition from MOTS system administrator to road system administrator, is my guess, but that's not all defined yet. Cecilia, of course, our ROC as MOTS support specialist. Myself, senior systems analyst. Mary, also always there for support and any questions about the system or anything that needs to happen, any changes, you can Dr. Mary Jody, our EDI technical expert or specialist. Also, Rhodes product owner. She's sharing that title at the moment with Kayla. And EDI stands, for those of you who do not know that, for Electronic Data Interchange, because today it is focused on client entry, which is a portal that we have, the web portal, where you just log in and you type in the data and you submit it while you're typing in there. EDI is you pull files from your electronic health record or electronic medical system, and you deliver those files into a portal, and then they get processed overnight. And Jody knows everything about that. And then Justin, our MOTS report specialist and research analyst. And Anna, of course, also in that task, because we have plenty of questions for individuals. If you have any questions about your information that you would like to see, send it to the MOTS support, and it'll end up on Justin or Anna's plate, and she will be gladly to help you, and they're very good at that. And of course, we have Kelly, and the new member of the gang, who is our Rhodes communications analyst, and also a little bit for the MOTS still while we're in transition. So, thank you. That is the team. And the next is, why do we do this? Well, you probably all know that we like to share our information because there's always change in our world of electronic health record systems, and we would like to provide you that on a monthly basis, and we like to do that every first Wednesday of the month at 9 o'clock, so you know when it is and where it is. And if you, because sometimes you have a question and you submit an email and it gets lost in a shuffle, or people don't have the time to answer it right away, but we do strive to get all the information that we think is pertinent, and anything that's recently happened or will happen in the near future to inform you about that, and this is a perfect platform to do that. Talk about data issues. Sometimes there's certain trends that we notice that something is happening with our data, that it's skewing a certain way, or anything that doesn't seem to be right, and maybe we communicated it incorrectly with you guys and it's not coming in properly. So we like to discuss this and make that a topic. This is a perfect place for you to give any of your feedback, anything that is currently happening within your organization that you think we should be aware of. Please let us know, and maybe one of those bits of information will be a future webinar topic, and we can go to a more in-depth information about it and let you know where we stand and what we might be able to do with that specific topic. And hopefully, if you have any other questions that you might have or had in the past, or that will come up during the presentation, hopefully we can answer it. And if we cannot, then we will definitely find someone within our organization to get the answer and get that back to you. And then maybe bring it back the next webinar or in our messenger, because we have all kinds of other plateaus and platforms of information. Okay, that's it. Go ahead with the next one. That is, do not add test clients to MOTS. Justin, go ahead.
Yeah, thanks, Pete. We just want to take a moment to remind everyone, please do not enter test or practice or other fake clients into the MOTS system. Why? Well, they skew the data in our aggregate reports. For example, if the legislature wants to know how many people are in alcohol treatment, we want to give them an accurate number. And maybe one facility has entered Mickey Mouse or Luke Skywalker or whoever to practice with the system, which creates a small margin of error. But if every facility does that, or worse, every user, well, then we have lots of bad data. And they're hard to find. MOTS doesn't know the difference between a real client and a fake one, even if there are words like test or do not use in the name fields, or if they have the name of a fictional character. It's just not smart enough of a system to recognize that sort of thing on its own, which means it's up to human eyes to find these test or practice clients. And with the database recently surpassing 700,000 person records, well, that's not a small list to scan, and I think you and I all have better things to do with our time. That said, we understand that there is sometimes a need to practice using the system, and we do have options for that. So for those of you using client entry, we have the MOTS training environment. It's a web application that works just like the real client entry web portal, but its data is stored separately, and we do not query it when creating reports. In fact, the only difference I'm aware of between MOTS training and the production environment is that some of the drop-down menus like diagnosis don't get updated quite as often, but otherwise it functions the same way. So if you have test clients that need to be deleted, or if you would like to use the training environment, or both, please send us an email at MOTS support and we can help.
Excellent. Thank you, Justin. Yes, the training environment is a pretty good copy of the production environment, except there's all kinds of made up providers and stuff like that. But Kayla will mention that in a little bit, and she'll talk to you about that, I think, by intro to MOTS. We'll get that at the agenda number 9. Yes. Okay, Kelly, microphone is all yours.
Hi there. Can you hear me?
You sound good.
Great. Well, I'm Kelly. I am the new comms person that's been brought on, and I'll be helping with some of the materials you're going to be seeing. And one of the first projects I got to work on was to give the MOTS Messenger a bit of an upgrade. So you should have received that last month, and you will still be receiving MOTS information and updates. But as we're kind of gradually transitioning to roads, we just thought this better aligned with the direction we're heading in. So if you're not receiving it, you can reach out. We'll add you to the list, and I look forward to working with you guys.
Thank you, Kelly, and thank you for turning on your camera. So it's always nice to see your face with the voice. So. Okay, what was next on the agenda? Where are we? Kayla, MFA, go ahead.
Good morning, everyone. My name is Kayla. You probably saw my name on that MOTS Teams list, but I'm just realizing that this slide is a little big. The title's getting cut off there at the top. Anyway, this is talking about multi-factor authentication for the roads system. So if you've been to a webinar before or you've looked at the Roads Navigator, you would have seen us talk about MFA and how when Roads goes live, it will be a necessary element in order to log into the train system and to log into Roads to use it. In order to configure MFA, folks will need to do one of two things. You'll either need to use the app avenue, so that would be downloading the Microsoft Authenticator app on a phone and using that to verify your identity before you log into the system. And for those folks who don't think they can use a phone, there is another option that is called a YubiKey, but we want to make sure that folks are aware that the YubiKey option isn't necessarily easier than the phone option. And we're going to be having a couple YubiKey info sessions later this month and maybe early in March to kind of walk folks through what using a YubiKey will look like to make sure that it's the right choice for you, because it will be a bit in depth and require downloading an app on your system or your workstation, and then having a physical key that you connect to that workstation to communicate that you are the person because you have that key. So it's a bit complicated. The YubiKey process is a bit complicated, and we want to make sure that folks are aware of that expectation before they decide that that's the method they want to use. So MFA is coming up, and we will be having, over the next month in February, Kelly and I are working on getting out training materials for MFA. So if you feel really confident in technology spaces and you feel confident that you can configure MFA on your own, we'll give you instructions for how to do that. And we'll also be hosting webinars to walk people through who might need a bit more assistance, and we're happy to do that. We just want to make sure everybody gets MFA configured and is ready to go when Roads launches. And I think I have the next slide, so I'm going to roll right on through here and thank our beta testers. The Roads MFA team had 3 beta test sessions over the last couple weeks, and those folks who joined those sessions really helped us refine the materials that we use to instruct folks how to get through this process. And I wanted to spend a couple seconds thanking them, because really without their help, we would have been in a really tough spot, especially because our team is unable to see the process of MFA from a provider's perspective, because our MFAs have been configured for years since it became required of the state, 2 years ago. We've had that, so we can't see the screens that you're seeing. So it's a lot, the beta tests were a lot of, well, tell me what you're seeing on your screen so that I can try to give you the right instructions to get to the next step. So be on the lookout for further webinars. If you're interested in being a beta tester, I will never say no to people who want to help me refine materials. Just shoot us an email. I also, I got the link here for our next one, and I'll put that in the chat here in a second. But thank you for engaging with our beta test, and we look forward to helping everyone through the MFA process.
Thank you, Kayla. Then I think it's up to Mary to talk about our next webinar coming up about MFA.
So our next webinar for applying the multi-factor authentication is coming up on February 28th, and Kayla is going to put a link in the chat where you can register. It does require that you have access to Citrix. That's through your P number, so make sure your P number, you can log in with your P number, and a smartphone. So, and that's all I have.
Thank you, Mary. Back to the agenda. Then it's Kayla again, intro to MOTS.
It's me again.
Yep.
Intro to MOTS is, well, I thought it was new until Mary reminded me that we'd been doing it for 6 months. Still feels new. Is a webinar that we put together to give folks just a quick intro of what MOTS is and why it exists and why we have people submitting data to the system. I think it's really important that folks understand the reason behind this, because it's not just us, making your lives more difficult. It's really useful information that we're getting in order to fulfill requirements that we have from the federal government, mostly. But we get into that in depth in this webinar. Our next one is Wednesday, February 14th from 10 to 11. I'm putting the link in the chat right now. So it is in there if you want to join us. We do a demo of the MOTS train environment. So it is geared a little bit more towards client entry, so folks that use our web portal to submit that data. But the first half of the webinar is general information about MOTS, how the information is organized in the system, and that information is all going to be transferable to the road system. So a lot of the reasons, the reason why MOTS exists is going to be the reason why roads exist. So if folks are hesitant to join the MOTS thing because we know roads is coming, I would say join us anyway, because a lot of the information is going to stay the same. Obviously, the web portal is going to look different once roads launches, but I'm confident that folks will be able to catch up and pick that up once we go through that training. So the link is in the chat if you'd like to join us. I usually send this information to new providers that are registering for MOTS, are registering with the MOTS system to submit data for the first time. But oftentimes folks at their agency will assume MOTS reporting responsibilities even after their system or their facility has been reporting to MOTS for a long time. And so if that's new to you, if MOTS is new to you, we really recommend jumping on this webinar so that you can get the baseline of what MOTS is and why it's there for you. Thanks.
Thanks, Kayla. Yeah, I think it's about 95% of MOTS will be going into roads, and then roads will be more from other parts of the information that providers are required to submit to the state. So we're trying to, also one of the things in roads is to kind of pull everything together so you don't have 17 people within your organization submitting bits, a spreadsheet here and a spreadsheet there. And that's one of the goals that we've had with and we're trying not to go overboard with the rows, but we'll try to find the nice balance. So, okay, thanks, Kayla. And then we give the microphone to Jody. Hey, Jody.
Hey, thanks, Pete. Yeah, I'd just like to tag on to the intro to MOTS. It's really great too if you've actually got maybe folks who aren't putting the data in, but maybe they're the people getting it to you. Or, like on the EDI side, we have, end users that are putting stuff in and sometimes they wonder, what is this for? Why is it for? And Kayla and Mary and team do such an amazing job of sharing that and sharing how they're such an integral part of the process for clients to get the services they do. That if you got any of the pretty much anybody, I think it's for anybody who's wants information on MOTS and roads. So anyways, with that, I will move into what I'm supposed to be talking about, which is switching from CE to EDI. If your organization is maybe your EHR is fine, is developed the export to come in through electronic, or you're looking at new systems, maybe upgrading, aligning with something that is more relevant to, the modalities of your clinic, then please let us know. Let us know. Notification of change is like number one, even if it's 3 months, 6 months, a year. Just give us a heads up. We can get you plugged into our schedules and make sure we have folks aligned to help you. The electronic health records and MOTS functionality, that is also something that if you're looking at EHR systems, there's no one way that's better than another for how the data and the files, as Pete was mentioning, come from your system to MOTS. But there's differences in workflows and differences in process. So if you're looking at new systems, lessons learned from others have said, hey, we really asked to see like how exactly does MOTS work end to end, like because the myth is that everything is just goes in the background and there's no human interaction sometimes, and that's kind of a little unrealistic. So to set everybody's expectations when you're going to a new system, just ask how it works, see it in theory. You can figure out who's going to do what once you go live. If you have any questions for me, I'm happy to answer just basic things in regards to what we require. Project timing is super important. That's why we ask you to let us know of your change. There is a well laid out process for doing this, going from CE to EDI. So it will be a very streamlined. We've been there, done that. So you're going to be well covered. There is a secure file transfer protocol set up. And basically, this is just a mailbox on a location here on our systems where you actually, or your system, will drop your files so that MOTS can, or roads/MOTS, can pick them up, process them, and let you know what's what. So that's a real important thing. Takes a little bit to get set up. So we like to do that ahead of time before you go live completely. There is also the client IDs to consider. So if you've been, entering client IDs, maybe they're upgrading IDs because your new system has assigned ones. We want to talk about that, the implications or impact, or just, plan of what we're going to do to make sure everything's in alignment when your data comes in. Defining the business processes. This is kind of an internal thing for you all, but we like to put it on here just to give you something to, like think about, because maybe you've never done this before, right? So those business processes are just who's going to do what, when, where, and how. And once you know how the system you're getting works from end to end, that'll be really help to identify those processes. Testing of the files through EDI. So even if you get you sign on to an EHR that's already submitting data with other customers, and so you're like, well, hey, it works, like everybody else is using it. We still test your files at the provider level, and the reason we do that is because there's so much customization nowadays with which is why you're maybe switching to a different one or doing something else. Well, we want to make sure that all of that customization and mapping and new fields and workflows that you get line up with the specifications for the actual file that needs to come in. So we've been there, done that. We'll walk you right through it. It'll be I'm not going to say easy, but it'll be achievable. And then we're going to go live, which is always the exciting part. Then your live files start coming in. And once your live files start coming in, we've probably already been meeting, right, frequently to get you up to speed. But we do offer follow-ups for you and maybe your EHR or whoever your contact people are. Because once you go live, sometimes now you got real world stuff happening. You've got submissions coming in, you got real errors coming back. And so we offer those follow-up touch points. You can be weekly, bi-weekly, monthly, not at all if you're good, which is totally fine. But we want to make ourselves available to you so that we can help you in your process work as smooth as possible and make it a positive experience. So with that, I'll just remind you, let us know if you're thinking of switching. And if you are looking for EHRs and you want to know, hey, does that one currently submit to MOTS? Feel free to reach out to us and we can let you know if that one is actively sending and data to us. So with that, Pete and Kayla and team, I will pause and hand it back to you unless there's any questions.
Thank you, Jody. I have not seen any questions. I saw some nice links that Kayla put in there, but that was about it. So no.
Okay, awesome. Well, and I really think it was great that you, just as the whole team said, roads is MOTS. So don't hesitate to check out all of our stuff. We're going to help guide you from one to the other. So, yep. Okay, Pete. Excellent. There you go.
Thanks, Jody. No questions, no answers. Okay. As I mentioned at the beginning, the recording of the webinar will be on our MOTS website, and it is under webinars and newsletters. So it's also one thing that I mentioned, that we also have the MOTS Messenger, which will now be the Roads Navigator. I remembered correctly. And that's going to take over, and it'll still have all the MOTS information that you're looking for. So intro to MOTS, training to the MOTS, getting familiar with the information, with the data, what we do with it, because it's not only to report to the feds that we get money to Oregon, but also local legislature and a lot of our managers, upper management, so they know what's happening within the behavioral health world in Oregon, what is working, what is not working, how can we improve, what can we learn from which areas, which organizations are exceeding. So maybe we should have a good look at what are they doing over there, that it seems to be working better than somewhere else. So is it because of a local issue? Is there something else we need to change? And is it small things we can kind of like improve, or work with the other departments that we can work together to improve the behavior health and the mental health and the health in general of Oregonians, because that's one of our mission statements that we have, of course. So, okay, the next EDI webinar will be, like I said, the first Wednesday of the month, which will be March 6th, and it is at 9 o'clock, and on our website you can sign up. And one quick check with everybody else to see if there's any question, and anybody raised a hand? No. Okay, here is the contact information that I promised earlier, MOTS support at odhsoha.oregon.gov. The state thing is all gone. It's all oha.oregon.gov, and some a little different than the others, but the MOTS and roads. And then for Kayla, Cecilia, myself, Mary, Jody, Justin, Anna, and Kelly, we're all there with first name, last name, and oha.oregon.gov. Fairly easy to remember. Okay, I think that was it. Thank you all for joining, and have a wonderful rest of your day. Take care. Bye-bye.
Thank you.